I am Dr. Bhagya Lakshmi, Senior Consultant Gynecologist from Yashoda Hospitals Hyderabad. Today I would like to highlight a few points on CS cervix, that is cervical cancer. As you all know, breast cancer and cervical cancer was the most leading cause of death in women, and cervical cancer particularly is something that can be easily treated and prevented. So how do we prevent cervical cancer? One is by taking vaccine and second is by doing regular screening. Vaccine is given from the time of menarche till the age of 35 as cervical cancer vaccine, because cervical cancer is caused mostly by human papilloma virus. The other thing that has to be done is every woman should go for regular screening by either doing a pap smear or co-testing or screening for HPV virus. Pap smear is done every 3 years and HPV screening is done every 5 years. Why do we need to do this? We do this because cervical cancer, as I told you, is caused by a virus called HPV virus, human papilloma virus, and for the virus, from the time of the viral infection to the changes to pre-malignant stage to the cancerous stage takes many years. So if a woman goes for regular screening, early changes can be detected and adequate treatment can be given so as to prevent cancer. Even if it is detected in a very early stage, it is easy to treat with a simple surgery, or even there are other conservative managements for young people like cryocautery or conization. So depending on the type, depending on whether it is CIN 1, 2 or 3, treatment will be given. So what are the symptoms if supposing somebody has not taken the vaccine, somebody has not gone for screening? You should also watch out for certain symptoms. Like most common symptom will be a vaginal discharge. It may be, many women have physiological white discharge, but this type of discharge is very different. It may be watery, it may be blood stain, it may be foul smelling, and sometimes even tissues can come out with this discharge. Second thing could be abnormal bleeding, which could be intermenstrual bleeding or prolonged bleeding during periods. Particularly they have this intermenstrual bleeding and also have postcoital bleeding, that is, woman experiences some amount of staining or bleeding after intercourse. The other things would be the woman, if it is little more advanced, then the woman can face with pelvic pain or bladder disturbance, bowel disturbance, bony pains. Now these all come in a later stage, but the earliest symptoms would be vaginal discharge or bleeding per vaginum. But most often the cancer progresses to a very advanced stage before a woman presents with symptoms. That is why screening and vaccination are very important. Even if a woman takes vaccination, screening has to be done, particularly from the age of 25 to 65. If it is pap smear, once in 3 years. If it is screening for HPV virus, it is once in 5 years. So it is one of those cancers which can be diagnosed early in a pre-malignant stage or in the early malignancy stage, and it can be treated so that a woman can have a good quality life for a long period of time. Who are the women who are more prone to develop this cervical cancer? Women who start their sexual life very early, or women who have multiple sexual partners, and women who lead a sexual life for a longer period of time, because this is transmitted by a virus called HPV virus, and this is only through sexual transmission. That is why a girl should get vaccinated before she is exposed to her first sexual intercourse, so that she is well protected. And using contraceptives is also a very important technique so that the HPV virus is not transmitted. Taking vaccine for this cervical cancer also gives a woman protection from vaginal cancer, vulval cancer, and even genital cancers and anorectal cancers and even oral cancers. So it has many benefits. So vaccination, screening, and leading a proper sexual life, not exposing to too many partners, taking precautions during intercourse, and going to the doctor with slightest symptoms will help a woman to protect herself from cervical cancer.